Dr. Zwelling, you're in private practice.
I am.
Obamacare will affect you dramatically. Let's talk about in what ways.
Governor, this act, this law, unfortunately, dismembers the very foundation of health care, and that's the patient-doctor relationship. Everything good about health care happens between me and my patient in an exam room. 4 walls, a closed door, and the government doesn't belong there. This bill...
Well said.
This bill invites the government not just into the room, but into the process, into the decision process. It takes away choice. It takes away privacy. I mean, imagine your records are now sent to the federal government for their perusement. It's abominable. It's abominable. And the sad thing is that it doesn't allow physicians to do our job. We just want to be able to do our job. We're professionals. We want to work for our patients. I introduce myself when I talk in front of audiences, my patient's doctor. We are the most privileged profession in the world. And every doctor in this country needs to be able to practice his expertise and work for the patient sitting in that room. And I say, give them that better day. That's what they deserve.
Let me talk, Dr. Burgess. One group of people that I think were left out, and I don't understand, I'm a little sensitive to it, the governors of America were left out of this. And the reason I say that is because in every state, governors run the largest private health care system in the state employs, which is usually the largest employer in a state. They also have the largest public insurance plan, Medicaid, huge. The costs are choking states. Governors, to my knowledge, were not consulted on the impact for their budgets.
No, they were not. And Governor Herbert was at a panel just 2 weeks ago, and he articulated that very thought. I always wondered, why in the world didn't we bring Mitch Daniels in and tie him to the chair until he spilled the beans about how he was able to provide health insurance for his state employees at 11% less than 2 years the year before, and he did that with a high deductible health plan and a health savings account that he funded. And then the governor found something really intriguing. Something magic happens when people spend their own money for health care, even if it wasn't their own money to begin with.
Yeah, Mitch Daniels, the governor of Indiana. There are a lot of governors around the country who are utterly scared to death that if they implement all of the terms of Obamacare regarding Medicaid, first couple of years the federal government will pick it up. After that, they're on their own. It'll wipe them out. Dr. Zwelling, let's talk. What would you say needs to be the fundamental plan of any real reform that's good for the patients? You know, even if it's not good for the doctors or the hospitals or the vendors, I want to know what's good for the patients out there.
Thanks for asking. It's about time somebody asked the doctors what we did.
Yeah. Somebody had to do it. I decided it would be me.
Indeed. First of all, doctors do not... We acknowledge that health insurance is absolutely important, and we believe that everybody needs insurance. But let's be clear, insurance is not assurance of anything. Insurance needs to be that thing that you own to protect you from the God forbid. It's an actuarial bet. It's that car that you have to use. You hope you never have to use it, quite frankly. You never want to use your car insurance. God forbid you should ever use your house insurance. Why are you proud to use your health insurance card? So doctors would like to work for their patients. We believe in a market, a place where patients can come to our office and tell us what they want and need, and we can provide it in a marketplace that is so much less expensive. Congressman Dr. Burgess talked about high deductible plans. Many doctors, and most doctors, as you know, would love to be able to actually collect cash at the door. What a concept would that be? Why can't we post our prices and work for our patients? Everybody else does. Why can't I be the best doctor in the world and compete with the guy down the street? I want to be able to be better than he. I can post my prices, and I damn well better be sure that I give my patients what I promised to give them for that price. And if I don't, they should go elsewhere.
Wow. How refreshing to hear that kind of candor. I'm going to pose a final question to each of you. If Obamacare does go forward, and right now it is going to, unless a new president and a new Congress repeals it.
We're going to win.
Well, let's hope so, for that reason. But God forbid it doesn't get repealed. I want each of you to give me the one scary thing that you think Americans need to know about Obamacare being implemented.
What people don't understand about the Affordable Care Act is nothing is free. And these very generous subsidies given to middle-class families for the exchange purchase of insurance, the expansion of Medicaid, all of that adds up to essentially $2.7 trillion, according to the latest Senate Budget Committee projection. We are $16 trillion in debt today. We are going to have a dreadful fight over a debt limit extension in December, January, or February. And on top of that, now we're going to implement this new entitlement that is likely to be more expensive than anyone projected, because remember, Congressional Budget Office said people will stay on their employer-sponsored insurance, but now you're hearing that employers are saying, you know, I don't know that I want any part of this deal. And if the government's going to buy them insurance, then, you know, who wants to shop for insurance at the HR department? Nobody. So this is a big conundrum that's coming our way, and the price tag is something that the country simply cannot sustain. Dr.
Zwelling, your greatest fear?
The IPAP, the Independent Payment Advisory Board. And by the way, this is something that we passed through. Thank you, Congressman. This is something that Congress did pass, and it has bipartisan support. In fact, a congressperson, a Democrat in Long Beach, actually sponsored this bill to repeal the IPAP. What this bill does is it takes even Congress out of play. Everything sits in the Department of Health Services. All decisions sit there. Imagine you need a procedure to save your life. You have to call up the government to see if it's okay? No, 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 no. We will be budgeted. The health care will be budgeted. There will be a cap on health care. And when we meet that cap, we're done. We're done. It will absolutely deny care to not just the seniors, but to everyone in this country.
I think people need to be listening to you. I wish the White House had listened to you. I wish that the members of the House and Senate who were pushing this on the Democratic side had listened to you. But can I give you some good news? America is listening to you, and that's good news. And I hope they will continue to. Dr. Zwelling and Congressman, great to have both of you here.
Thank you, Governor.
Thank you.